Good morning, everyone. Welcome to another series of our 8-part webinar series. This is done through the Utah School Mental Health Collaborative, which is a partnership of several organizations and donors, which we will talk about. So thank you for being here. And again, welcome to our March series. So the Utah School Mental Health Collaborative is housed within the Utah Collab at the University of Utah Department of Educational Psychology. We are a technology in training, education, and consultation lab housed within the College of Education. First, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from, again, funders and collaborators. So we have Cambia Health Solutions, we have the Huntsman Mental Health Institute, we have ULEAD through Utah State Board of Education, and we also have Utah State University. So before we get started, my name is Chad. I am the postdoctoral fellow in the Utah Lab. I am also the project coordinator for the Utah School Mental Health Collaborative. If you have watched previous series, I host all of these series, and we have 2 more remaining, and I will also host both of them. So if you have any questions about any of these series or presentations, feel free to reach out to me. My contact information will be provided at the end of this webinar. So the content for today's training was developed by the Mental Health Technology Transfer Center Network, we also call it MHTTC, and the National Center for School Mental Health, which for short we call NCSMH. The MHTTC hosted an 8-part training series using the National School Mental Health Best Practices Implementation Guidance modules for states, districts, and schools. So this resource was developed by MHTTC Network in partnership with the National Center for School Mental Health. And this series really aims to help states, districts, and schools advance comprehensive school mental health and also engage in a planning process in the implementation of that work. So the primary intended audience for this series is districts, school teams, and community behavioral health providers who develop and oversee school mental health systems, maybe class-wide, building-wide, and also school-wide. So here you see kind of 2 manuals. One is the trainer manual, and also the other is the participant manual. And these manuals were released as a part of this training series. If you are interested in getting your hands on this, I'm going to quickly put the link on the chat. It is kind of a form that you have to fill. Sorry, it's a form that you have to fill, and once you put your contact information, they will give you access to that. The form is coming up here. So the first link that I put will kind of like take you to a site that provides you information about these manuals, but then the second link that I put will get you access to these 2 manuals. So both of these manuals kind of contain like all of the slide decks covered throughout these 8 series. It also talks about kind of core features of comprehensive school mental health. It gives you so many resources and examples. So I would highly recommend that you try to get your hands on this resource as well. So these were kind of like the 8 different modules that are covered in that manual and also covered in this series. So again, we so far have covered the first 5. So foundations of comprehensive school mental health, teaming, needs assessment and resource mapping, screening, mental health promotion, which is also tier 1. Today we will cover early intervention and treatment, which we call tiers 2 and 3. And in the next 2 months, April and May, we will cover funding and sustainability and also impact. So just disclaimer, today I will just briefly recap module 6, just kind of given time constraints. We'll kind of focus on the best practices when it comes to implementing them, but I would highly recommend if you go into the MHTT website and actually get your hands on this complete recording. It's very comprehensive. It goes through, again, several examples, and I think it will be really helpful kind of given the context of your school, district, or building. So before we do get started, I want to give a really quick disclaimer. The opinions expressed in these learning sessions are the views of presenters, and by all means do not reflect the official position of the Department of Health and Human Services or SAMHSA, the MHTTC network, and the National Center for School Mental Health. There's no official support or endorsement of the HHS, SAMHSA, or the opinions described in this document is intended or should be inferred. With that, so we can go ahead and get started. So I'll spend a few minutes kind of sharing some highlights from this module as a refresher. But again, please do, if you get the time, actually watch the full recording for this particular webinar. So today's brief lineup, we will kind of talk about the definition and the value of mental health early intervention and treatment in schools. We will talk about some quality indicators and best practices to effectively implement some of the tier 2 and tier 3 services and supports. Many of the implementation indicators that we will talk today are kind of similar to those that we discussed last month, which is module 5, which is tier 1. So we will kind of review and include like some considerations how those from tier 1 could be applied to tiers 2 and tiers 3. Okay, so I'm going to give you a couple of seconds to kind of read off the slide, and then I'll kind of walk you through this particular definition. So mental health early intervention, or what we call tier 2 services and supports, are sometimes referred to as mental health prevention or kind of secondary prevention services. And these strategies are designed to address kind of the mental health concerns for students who have been identified through a very systematic and equitable process, and those who are experiencing mild distress or functional impairment, or are kind of being at risk for a certain problem or a certain concern. So some examples for this level of intervention services are kind of like the small group interventions for students who are identified with similar needs or similar concerns. Some examples are like the very brief individualized interventions are motivational interviewing, or you have kind of the group problem solving or small group mentoring. It can also be like the very low intensity classroom-based supports like daily report card, daily teacher check-ins, home to school notes. So again, the most important thing to remember is this level of service is provided to students who are experiencing mild distress or are at risk for experiencing certain concerns. It's also important to note that this level, so like the tier 2 services and supports, may also be appropriate for students experiencing more intensive needs, but they're always accompanied with more intensive services and support. So students who are receiving tier 2 sometimes will also need kind of more intensive services in addition to this kind of small group level interventions. So the value of tier 2 services. Early intervention is critical to any multi-tiered system of support in your district or in kind of your mental health system. And this is so for several reasons, some of which are listed right here. So mental health challenges often, first emerge at school, and school kind of becomes a very natural setting for us to identify students with such concerns and also intervene early on. And also children spend most of their time at school, so it's a very convenient environment to intervene. When problems are identified early and supports are put in place, the benefit is the severity of future mental health concerns can be prevented or reduced, rather than waiting to intervene later on when things get escalated. And of course, with that, early intervention promotes positive youth development. So very briefly, some values or benefits of providing tier 2 interventions. And then we move on to mental health treatment. I'll give you a couple of seconds to quickly read this definition. So mental health treatment services and supports, or what we call tier 3. So previously I spoke about tier 2, the early intervention. Now this is mental health treatment, which we call tier 3. These are strategies to address mental health concerns for students who are kind of already experiencing significant distress or functional impairment. And this is different compared to tier 2, because for tier 2, we generally want to target students who are maybe experiencing mild concerns or are kind of at risk, compared to tier 3, where we're targeting students who are already experiencing significant distress or impairment. So sometimes these mental health treatments are referred to as tertiary or intensive services, and they are very individualized to specific students. Every student is different. Their concerns are very unique. So with this treatment, we want to individualize as much as we can. Tier 3 or mental health treatment services can be provided by all school-based mental health professionals, including, it can be school employed, but it can also be community employed, especially if schools feel they need the extra support that's beyond their school capacity. So again, I want to iterate that typically these students who are kind of receiving the tier 3 services can receive general education. They also can be in special education, but either way, they have been identified and often diagnosed with, could be social, emotional, and or behavioral needs. So the value, again, similar to the value of tier 2 services, what is the value of tier 3 services? This is valuable for so many reasons. And again, similar to kind of the tier 2, schools are kind of a natural, accessible environment where kids and youth spend most of their life pretty much, right? They come to school 5 days a week. They're in school from morning to afternoon. So it kind of provides like a way to easily access students. So the other thing is mental health treatment in schools is effective in reducing mental health symptoms, just because of the easy access and the recurring services. And I wanted to share with you this graph right here. I'll give you a minute to kind of orient yourself to this image, and we'll kind of talk through some of the data. So here you see a graph which kind of portrays treatment initiation and completion rates of students in 2 different settings. So the darker line is a clinic-based and the lighter line is school-based. And then here you have, if you focus on the x-axis, you have students enrolled, students who started care, and students who finished care. And your y-axis is number of students. So you can see this clear line. Students who are enrolled are kind of similar to clinic and school-based, but those who started care dropped drastically in clinic-based settings, and then continue to drop when it comes to who finished care. Versus in school-based settings, children are more likely to start care and also finish care. So, mental health completion rates are obviously much higher in schools than in clinic-based settings. And in one study, over 90% of youth served at school completed treatments, as compared to kind of 15% of youth who were served in a community setting. So that's like a big increase in treatment completion. So this graph here kind of outlines the benefits, further outlines the benefits of being able to provide school-based mental health settings, and not only provide, but also provide them successfully. All right, so switching gears a little bit, we spoke about quality indicators, and quality indicators really look at aspects that you want to strive to comply by or achieve when you are providing these services in your schools. The more quality indicators you have, of course, the better quality your programs are. But there's so much that goes into creating quality services, and it really depends on resources, training, staffing, and even the knowledge. So these are kind of very briefly a list of quality indicators for kind of the tier 2 and tier 3 services. We will cover some of this for today. It's a very long list, but we'll pick some, and we'll kind of talk about the best practices, the resources, and also some helpful tips along some of these indicators. But I do want to remind you, please, if you do have the time and if you're really interested in kind of learning more about how to continue to improve your tier 2 and tier 3 services, I would highly recommend watching that recording. It also provides you much more resources than I will provide today. Okay, so we can start with like talking about tier 2 and tier 3 services. So in general, I think we all know tier 2 services, students who are referred to tier 2 services are identified through several avenues. We have assessments, we have screening, we have referrals that come in through educators or caregivers, and we also have teaming where your well-being teams kind of get together and discuss certain students who may be experiencing concerns. So there are so many avenues where students can get referred for tier 2 services. And once again, students who do receive tier 2 services are those who are kind of expressing the mild, you're seeing like very minor red flags or are at risk for certain given problems or concerns. So of course, when you do provide tier 2 services, you want to strive, or you want to abide by the best practices to provide evidence-informed interventions and strategies. We will kind of go through some ways of how you can be informed of these evidence-informed interventions, because there are so many, and kind of like learning to pick and choose what works best for the students, also what works best with the resources that certain schools have. But something like another aspect that you have to consider is kind of the mechanism to systematically identify students who will benefit from tier 2. And so, in schools, we kind of talk about what is the, how many students have access to mental health services in your school, right? And, sometimes we go back and forth, how do we capture this indicator? How do we know our capacity? And one way that you can obtain that capacity or obtain that indicator is identifying all of the students who would benefit from tier 2 services, and then counting the number of students who actually receive those services. So sometimes we know schools have concerns when it comes to being short-staffed or not having enough professionals, and that is a real honest problem that especially we see in the state of Utah. So, we have students on wait lists who are waiting to receive services. So kind of by knowing the number of students who need services versus the number of students who actually receive them, it'll kind of give you like an indicator of your capacity as a school to provide this level of service. So here, I just wanted to include this slide very briefly. This is an example of a tier 2 intervention. And why I included this was in the previous slide, we spoke about evidence-informed. So this is the brief intervention for school clinicians. This is a research-based and a completely manualized intervention strategy that can be used by school professionals. Sorry. school professionals who are working with high school students experiencing emotional and behavioral stresses and concerns. This intervention was primarily designed to be responsive to students, some of those typically presenting emotional and behavioral stresses. But the beauty of this is it's very brief, it's very flexible, and can be used again by a range of school-based mental health practitioners. Can also be used by licensed clinicians, school social workers, school counselors. So let me see if I can put the link if you're interested in learning more about this intervention. Again, this is just one example. And then we talk about tier 3 services. So similar to tier 2 services, you want to use evidence-informed interventions. And I'll talk about another example of a kind of an evidence-based tier 3 intervention. But compared to kind of the tier 2, where there are multiple avenues where students can get referred for tier 2, tier 3 typically comes through screening or referrals, because there's a more intensified need that needs to be identified. And again, these services are provided to students experiencing significant distress and also functional impairment. And just like how I spoke about capacity of schools to provide tier 2, there's also the capacity of schools to provide tier 3, again, for similar concerns like shortages of staff, lack of resources. So again, we want to be able to identify the capacity of certain schools to provide tier 3 services. And you simply identify all of the students who would benefit from tier 3. And then you count the number of students who actually receive those tier 3 services. And this indicator will kind of capture the access that students have to tier 3 services. So the other thing is, if you think of everything like your school or your district provides for tier 3, are there any? So think about, like, if you take all of the tier 3 services that are provided by your school, how much of those are evidence informed? Are all of the services you provide evidence informed? Are some like less than 25%, less than half, more than half? So these are kind of like some ways to kind of gauge where your school stands in terms of providing the evidence informed interventions. So this is an example of a tier 3 evidence informed intervention. As you read through this slide, I'll drop the link to this intervention where I obtained it from. So the cognitive behavioral intervention for trauma in schools, CBITS, is a school-based group and also individualized intervention. So it is kind of designed to decrease symptoms of PTSD, depression, behavioral problems, but also to improve functioning, academic functioning. So like grades, attendance, peer and parent support, and also like general coping skills of students. This procedure or this intervention uses very cognitive behavioral techniques like psychoeducation, relaxation, problem solving, cognitive restructuring, and some exposure. So I just want to put that there because there are very kind of packaged evidence-informed interventions that schools can actually pick if they feel like it kind of hits on the concerns, the target concerns of the students, if it's age appropriate. So for example, this is 5th through 12th. So this kind of all goes to say that we don't need to start from scratch. There's plenty of resources, free resources that are available. And some of these resources kind of provide trainings to walk you through these very tailor-made interventions. So the resources are available, just have to explore a little bit more. Okay, So switching gears to best practices. So I'll give you a couple of seconds to kind of read through this slide and we'll talk about it. Okay. So to what extent did your school or district determine whether tier 1, tier 2, and tier 3 mental health services and supports are evidence informed? So in addition to practicing evidence informed interventions, how do you evaluate or assess that something is evidence informed? So I'll go through some best practices that you could do before selecting an evidence-based informed practice. But if it's something that you're already doing, then you can use this information to kind of critically evaluate the current intervention or practice. So some very brief things we want to or we can do are create an intervention selection committee. So this committee, you want to make sure, just like our wellbeing teams, it's always good to make sure our committees or our teams are as diverse as possible, bringing in different perspectives, different ideas. So when it comes to diverse, you also want to include various mental health professionals or various staff in your school. So all the way from mental health providers, community providers, admin, teachers, students, and parents. So the more diverse your committees are, the better input and the more richer input that you will have. You want to develop a selection process and policy. So what is the process of selecting evidence-informed practices? What are some policies behind it? You can use and review national evidence-based practice registries. Some of those include IES has What Works Clearinghouse. You have several blueprints and certain like organizations, for example, Society for of Clinical Child and Adolescent Psychology. So these are like registries that have kind of set the blueprint for selecting evidence-informed practices. So again, all of these kind of go to say that you don't need to invent anything or try to like brainstorm. All of this information is available. It's just a matter of like accessing them. So you also want to review. So again, schools don't have to work in a silo or don't have to work in isolation. It's always nice to talk to other school providers that you know, and just like discuss the successes of their interventions or things that they have done. What do the outcomes look like? So it's always like nice to work as teams, and that's kind of what we try to do with the Utah School Mental Health Collaborative, is put schools together so they can communicate and talk about what has worked for one school and what hasn't worked for the other school, so they can kind of learn from each other. So these are just very brief examples of how you can evaluate or assess that something is evidence informed. So kind of, again, adding to that, when you do select evidence-informed programs, these are some other things that you want to think about. So the 4 components involved in identifying evidence-based practices. So first would be the intended population. For what's your target population? So you want to think about demographics. You want to think about age. You want to think about race. You want to think about language. And I think one of the example for tier 3 interventions that I presented earlier was kind of more geared towards children who were from between 5th and 12th grade. So something like that typically wouldn't work for kids in elementary school. So you really want to think about your population if you want like to have good results from these interventions. You want to think about the intervention target. What is the intervention designed to address? Different interventions kind of help address different concerns. So again, going back to like that same example, the tier 3 intervention was kind of designed to address more concerns related to PTSD. So again, everyone is different, everyone's concerns are different. So you really want to think about what is the concern that you want to address through this intervention. So you want to think about the baseline severity level. So what is the baseline severity level of existing risk factors and problems? So you want to learn about your students and see if they are at risk or if they are experiencing significant distress, because that also kind of like decides on what intervention you want to use. So you want to use more intensive or more targeted practices if concerns are more intense. And with that comes the intervention delivery. So if students are experiencing frequent recurrent concerns, then you want to think about how frequently do you want to provide your intervention. Do you want to see the student like twice a week, or versus do you want to see the student once a week or every other week if it's like very mild concerns? And also who delivers the intervention, people with skills, people with the knowledge. So we kind of also talk about the training portion of this when it comes to intervention delivery and practice. But in a nutshell, I just wanted to throw this slide on here. So this kind of like very nicely captures some components to think about. I also wanted to throw this resource here. When I mentioned there's tons of resources out there, these are just like two of the many. These are free resources. So SAMHSA has kind of like an evidence-based resource center. These are just screenshots. I'm gonna put the links to both of these. So the first one kind of talks about, it provides you articles, it provides manuals. So when you do have the time, or if you are interested, please do go explore. And the second one, by the National Center for Healthy Safe Children, these are like evidence-based module series. So it's very knowledge-based and kind of walks through what you have to do when you, what do you have to know when you select evidence-based programs? How do you plan to implement? So if you also keep exploring on this site, there are other modules. These are also free. They are self-paced learning modules. So these are good things for schools if you, you know, on professional days or the first week of school when, you know, it's only the staff and teachers. Like these are some modules that you can ask your staff to do, especially for those working with children and mental health work. All righty, so second question, and we'll talk about this set of best practices. I'll give you a couple of seconds to read through this and I'll follow up. So this is one of the other most important considerations when it comes to tier 2, tier 3 services. So to what extent did your school and district ensure tier 2, tier 3 services and supports fit the unique strengths, needs, cultural, linguistic considerations of students and families? This is something that we have stressed through all of our previous presentations. Our families are unique, they're different. So being able to cater and capture and cater to those differences and uniqueness is very important. So how do you do that when it comes to a tier 2 and tier 3 setting? So some best practices here, and the first one listed here is have a diverse committee. And just like the previous best practice, we cannot emphasize more. The diverse your committee is, the better input and the better range of opinions, ideas that you will be exposed to, which will eventually benefit you. Review your school's student body. So see what comprises your student body. Look at gender, look at age, look at ethnicity, look at cultural background, language. There's just so many, sexual orientation, socioeconomic status. So think about all of these in consideration of this tier 2 and tier 3 services. Review your school's mental health needs and strengths. This is kind of where like a needs assessment, which we covered a couple of months ago, about doing needs assessment and resource mapping in your school. So identifying what your school's needs are, and then identifying what resources you have, which means kind of your strengths, because that'll kind of help put things in perspective about what you can offer given the diverse student body that you have. We talk about funding concerns. So it's also important to review costs associated with kind of the different ways to implement the different interventions that that's essential or needed to your school. Evaluate the short and long-term training requirements and qualifications. So your staff's training to implement these, their qualifications to implement these, and also implement these with Fidelity. We'll talk about Fidelity in the next couple of slides. Pilot test a new practice. I kind of mentioned this when we spoke about screening. Screening is great if you have implemented it throughout your school by now. But if you are new to it, pilot it with a classroom, pilot it with a group of students. And that way you also kind of like, it also helps to manage your costs and your time and your staffing. Adapt practice to fit your school's population's unique considerations. There are certain interventions that allow you that flexibility to adapt to kind of not only fit the needs of the students, but also fit the population that you're working with. So very briefly, these are some best practices in consideration of cultural, linguistic, economic differences. All right. So again, I'll give you a couple of seconds to read through this. Okay. So to what extent did your school or district use best practices to ensure adequate resource capacity to implement mental health, so tier 2 and tier 3 services and supports? This kind of goes back into that the tier 2 and tier 3 slides I spoke about, like what is your school's capacity to provide certain services? So here it asks, how does your school ensure that that there is adequate resource and capacity to implement this? And of course, at this point, you might be wondering exactly how much it will cost in terms of staff time, training time, implementation time, monitoring those prevention and promotion activities. So consideration of like considering all of these factors is of utmost importance, right? If you want to kind of like optimize any intervention or any service that you're providing in your district or your school. So some best practices are evaluate staff capacity, including kind of the trainings that you're providing, the requirements, the qualifications, the staff time. So think about like the capacity of your current staff. If you do take it up, then like all of the other steps that follow in terms of implementing, monitoring, and measuring outcomes. Evaluate implementation support. So again, kind of the, you have to frequently check in on your staff, monitor the performance. So think about the ongoing trainings, the coaching, the supplies. If you like intervention supplies, right? But also like if you are purchasing certain like package interventions, then kind of like evaluating the costs associated with those as well. So kind of touches on cost. Also determine whether staffing, the implementation supports, and the cost of services are achievable and realistic. And if not, how do you again kind of pilot, or how do you effectively downsize? So some things to think about. So I know we spoke about Fidelity in the previous slide. So how does your school, or how does your district monitor Fidelity of tier 2 and tier 3 supports? So Fidelity monitoring kind of measures the presence of a program, like their practice and initiative when it's kind of being used day to day. So very briefly, some things that you can do to monitor Fidelity is identify a tool to monitor fidelity. If you are implementing kind of like a tool specific to a practice, then sometimes like these do come with like already made fidelity monitoring tools. But if not, you can very briefly create your own. Sometimes fidelity monitoring tools could involve reviewing student records, directly observing your school staff who's implementing these services, talking with anyone who you know implements these or receives these practices. Some things you do want to do, like if you are creating your own fidelity monitoring tool, some things you want to include are kind of like the adherence to intervention content. So like what is being implemented? Is everything that has been planned actually being implemented? So kind of the adherence. The quality of the program delivery. So think about the facilitators and like the actual implementation of the program. And also think about logistics, the length of sessions, the number of sessions, the environment in which it is being implemented. You want to determine the frequency of, so how frequently do you want to measure fidelity? Again, you want to do this based on how feasible it is. Like, do you want to measure every single session? Or do you want to observe every single session, monitor every single session? Do you want to do every other session? So kind of thinking about like a frequency that works well for you. Establishing benchmarks. So like, how do you measure? Do you want to kind of categorize fidelity as not acceptable, adequate, excellent? And the other things like constantly monitoring, tracking changes, if you want to like modify as you go. And also providing feedback once you do monitor. It's important to kind of take your team, go through the feedback, and then see how y'all can improve as a team. Again, this kind of just like some helpful tips. Some programs already have fidelity monitoring tools, but if you are thinking of creating your own, all of the information on the previous slide should be helpful. But you can also do record reviews or formal observations, which is very common when it comes to like fidelity monitoring. So here I know this image visual is very small, but I'm gonna put the link on the slide so you can access a clear copy. This is a basic fidelity monitoring checklist that was developed by the National Center for School Mental Health in collaboration with the American Institute for Research. So if you are thinking about, you know, a fidelity monitoring checklist and you are planning ahead, this is something that you can go by. So this is just a resource. Okay. So the next one is, to what extent did your district or school implement a systematic protocol for emotional and behavioral crisis responses? So I want to include this because every school does experience crisis in some capacity, right? Sometimes it's every week thing for some schools, or like every other day for some schools, you know, it comes and goes. So regardless, I felt like this was an important best practice to include. So having and implementing a systematic protocol for these sorts of crises is very important for a comprehensive school mental health system or framework. And particularly very important and relevant to kind of the tier 2 and the tier 3 services. So some best practices, I will also kind of go through an example, but some best practices for this indicator are as follows. So very briefly, I'll kind of go through some. You want to develop a protocol for emotional and behavioral crisis responses based on your entire team's input. So when you do that, some things you want to think about are, what are some specific types of behaviors or crises that you frequently see in your school? Who in the team is responsible to respond for those different circumstances? And in the event of a crisis, how do you connect students to the appropriate services and supports? You also want to include guidelines and procedures for getting in touch with caregivers in the event of a crisis. how do you give feedback to teachers or to school staff in the event of a crisis or when you debrief? And also when a student comes back, how do you support that student's successful transition back into the school setting, back into the classroom, connecting back with peers, connecting back with adults? So some things to think about. You also want to include instructions that identify mental health coverage considerations on different days of the week. And you also want to offer tips for crisis prevention, tips for crisis de-escalation, and tips to how to respond to kind of the different types of emotional or behavior crisis. And that you want to do in the event that you have limited staff, you have no coverage or you have less coverage, or that 1 or 2 people who are responsible for crisis management are not in the building. You also, once you do create like a protocol, you want to circulate this protocol to the staff and obtain feedback. You also want to reach out to your community partners if you are partnering with, for example, Safe UT that we partner with. So you want to talk to them and like go through and review your protocol and get feedback and modify. You want to disseminate crisis response protocols, but you also want to have it readily available for all school staff. Find places where you can put a copy. Could be in every teacher's file, could be on the classroom, on a separate space. So like finding creative ways to do that. And also, most importantly, once you have your protocol established, provide training and ongoing supports for your staff to implement this protocol. And after you do that, just like making sure there's ongoing coaching and ongoing support, and opportunities to learn from things that didn't go so well the last time, but we want to do better. So if you don't have a protocol for addressing crisis, or if you feel like you have a protocol, but it could use more modification, these tips right here are going to be helpful. All of these, again, resources are available on the full MSGTC training. So this here is kind of the most basic version of a crisis protocol that you can use, say, the school building level. This is developed actually through the collaborative process led by, a whole school mental health team, so social workers, school psychs, and community mental health clinicians. Of course, you have the admin, teachers, and other staff who do provide input into the creation of this plan. So just brief, as I read through, I know it's so, if you see at a glance, this is a very, very clear methodical protocol. It's very easy to follow. It doesn't have a lot of text. So when you do create a protocol, these are some things to think about, because in the event of a crisis and you are unfamiliar with certain steps, you don't want to be reading like a lengthy essay, right? You just want to look where you are and kind of follow through the plan. So when you are creating, these are kind of some things in terms of like visuals and presentations to think about. So switching gears a little bit, I want to talk, and this is actually my last slide. I do want to talk about TeleMental Health in schools. So through the Utah School Mental Health Collaborative, one of the things that we provide are telemental health services. And this is especially important. I mean, in the rise of a pandemic, we have used more mental health services than we ever have. But I think it was also a nice opportunity to make use of these services and kind of see the benefits of these services that schools can actually adapt and implement. So technology solutions, right? These are increasingly being used in schools to support students with mental health needs. The benefit or the beauty of telemental health equipment is that it allows schools to access specialty mental health providers. So it doesn't only have to be like a therapist. You can connect to social workers, you can connect to psychiatrists, you can connect to people who provide more specialized services and treatments, who may otherwise not be available to you if in a physical space. So it also provides that benefit. And you know, it's not only urban settings, but also we have rural settings where telemental health services are being used in schools. So you know, you can really be creative in how you use telemental health services if that is something you're really interested in. So all the way from direct care to consultation to even trainings. So all of these are ways that we can really make use of telemental health services. So, and again, since we're talking about kind of tier 2 and tier 3, this is kind of where we can use telemental health to provide those services to students. So with that, that kind of brings me to my last slide. I do have probably around 4 minutes. If anyone does have any questions, I'm happy to take them. All right, maybe I spoke really fast, or maybe it was crystal clear. I'll probably go with the last one. But with that, I want to give a big shout out to everyone who joined us today and to everyone who will watch this recording, even though it wasn't, even though they couldn't participate live. But a lot of, like, all of the content for this presentation was obtained through the MSGTC and National Center for School Mental Health slides and resources. So I want to give credit to them. But if there's any questions about this series or any of the mental health services or comprehensive school mental health networks, or even the Utah State School Mental Health Collaborative, you can contact me through that email, but feel free to follow us on social media and see what we are up to. But thank you to everyone who attended. Thank you to our schools who attended today and our representatives who attend today. Until next time, which is in April, where we talk about sustainability and funding. I'll see you then, but in the meantime, have a good rest of your March.